Hey y'all, my name is Dr. Laura Ross. I'm a physical therapist, and in this video, I'm going to give you 4 exercises that you can do after you take your binder off to make sure you have healthy movement in your chest, your rib cage, as well as your shoulders, and hopefully to help you alleviate the pain that's sometimes caused by wearing binders. The first exercise we're going to do is breathing. One of the things that happens when you're wearing a binder is it restricts rib cage movement. And so just getting some nice, easy breaths can help to mobilize some of that tissue when you remove the binder for the day. Your rib cage is actually curved in the back. And so you're meant to have more expansion outwards, kind of like a bellows for a fireplace, and back into your back. And so a lot of times when you're wearing the binder, you're breathing more into your chest. So for this exercise, we want to think out and back. You can place your hands gently on your rib cage here at the bottom and just feel yourself gently opening. There's no need to push here, just easy opening breath. And then you can see that move in my back as well. If this is challenging for you, you can also do this in a child's pose position so that you can have more movement in your back. And that looks kind of like this. If breathing into your back and out to the side is hard in sitting or standing, you can also do it in a child's pose. So easier to block the movement of the chest and feel that movement into your back as you breathe. In the next exercise, we're going to be doing a chest opener, and you can use a long foam roller or you can also use a yoga mat. So for this one, what you're going to do is you'll lay on the foam roller or the yoga mat with your head supported on one end and your rear end supported on the other. And you're just going to let gravity take over here, just allowing your arms to go out to the side and just allowing them to rest and feel that opening and stretch in your chest. If this is too extreme, sometimes a yoga mat is easier. Same thing. And just allow some gentle opening of your chest. For the next exercise, we're going to do 2 different kinds of shoulder range of motion or movement of your shoulder that are limited often when you're wearing a binder. To set up this exercise, you can be laying on your back with your knees bent, and you can put something underneath your knees if it feels supported to do so. I'm going to demonstrate this on this side, but you can do both of these at the same time if you want to. So the first one is just moving your arm up overhead like this as far as you can that's comfortable. You may notice a stretch in this area, and that is okay. No need to push this, but going as far as you can and then come back. And you may notice that you start here, and then as you do this a few times, you're able to get all the way to the floor. Ideally, doing this on the ground helps you from not, overarching your back to do this. So try to keep your back nice and relaxed while you're doing this so the motion comes from your shoulder. The second one we're going to do, you're going to have your arm bent, and you're going to try to move your arm back and forward just as far as is comfortable. Again, it might be here. It might be here. Everybody's a little bit different, but we're just trying to get some motion within your comfortable range. The last exercise I'm going to show you is one of my favorites called the open book. Kind of puts a few of these things together. To set up the open book, we're going to use that same foam roller again, or you can use a yoga block or a pillow, just something to let your leg rest on. You're going to lay on your side, put your leg up on that foam roller where your knee is in line with your hip, and this should just rest here. It doesn't have to be very active. You can have a pillow for your head to rest on if you want to. Your hands will be set up in front of your shoulders. And then what we're going to do is we're going to open the book, taking your top hand and moving it over and out, keeping your leg on that foam roller. and then coming back. What you don't want to do is to not move your head, because that becomes just a shoulder stretch. We also want to incorporate your back into this. So move your head with your hand. You can think about it like your nose and your hand are going to move together. So my face and my hand are the same, and then I come back. And if your knee comes up a little bit, that is not a big deal. If your range of motion is to here, that's not a big deal. You don't have to go all the way to the floor, just go within a comfortable range for you. For all of these exercises, you don't need to do a ton of repetitions. You could get away with doing 5 to 10 of each of these, or less if it feels better for you. For the breathing piece, as well as that just kind of holding and allowing your chest to open, try it for a few minutes and see how it feels. I think you'll notice that if you take 5 to 10 minutes after you take off the binder daily, you will notice a big difference in how you feel. Thanks for watching this video. I hope that it's helpful for you. If you have any additional questions, please reach out. I'd be happy to answer any of them for you.